hospital and knew how difficult it was for frontline health workers to eat properly. She spoke to her dad, who happens to be Ron Dennis, the businessman and driving force behind McLaren, who led its Formula One team and turned the group into a commercial force. He was inspired to start a new initiative, salutethehs.org, and he used his experience, contacts and, yes, money to deliver meal packs to NHS staff. He's put in £1 million and is working with the likes of Tesco, Absolute Taste and Yodel. Well, we can speak to them both now. Ron Dennis joins me live from Surrey and Charlotte Hall joins me from Oxfordshire, where she's currently training young doctors to use ventilators. Welcome to you both. Charlotte, let me start with you. How bad was the situation before?
So the situation is really bad. I haven't been in the hospital for a couple of weeks now. I'm self-isolating at home. But before I left, it was just beginning to really ramp up. And I speak to my colleagues daily about the situation on the hospital floor. And things are beginning to really get quite bad. But they're doing an amazing job and they're really trying as hard as they can to work their long hours and dedicate everything to their NHS and their patients.
But it was a real issue for the doctors and nurses to get proper food.
Yes, absolutely. So our doctors, the anaesthetists, intensive care doctors, A&E, they really struggle to leave their clinical areas. Their shifts are 12 hours long. So the idea of then being able to go shopping before or after those shifts, prepare a meal and eat that meal and still get enough sleep between those shifts is really a problem. So this initiative just wanted to bring fresh, healthy meals right to their area of work so they didn't spread the infection around the hospital and they could actually eat something that would keep them going during these shifts.
Well, Ron Dennis, let me bring you in and congratulations on this initiative. It must be an immense logistical challenge.
Well, it's a big problem, and I think it needed a big solution. So I spent quite a lot of time thinking, like about 2 hours, and in 10 days we've mobilised a huge force, and our target is to reach 10,000 meals a day as fast as possible, and we will hit 1 million over the next 3 months. But we're not only providing the food on the coalface, as it were, but also the staff will be able to pick up a food pack on the way from the hospital, and that's a complete meal. And then in conjunction with the hospitals, we built this model up with the John Radcliffe in Oxford, as they are able to identify those members of staff that are actually infected and in isolation, we will deliver a 5-day food pack to them. So we'll actually look after those staff that are unwell. It's quite a logistical challenge, but not quite the same sort of challenges of running a Grand Prix team all over the world, but still complex. And a lot of fantastic companies have stepped up to the fore, not least Tesco and Yodel, but a whole host of other people who've really lent their support. We've raised a lot of money, but we haven't spent much and at the moment, but we will be pouring money into those areas that will best affect the optimisation of the solution.
Ron, are you still looking for firms to partner you in the cause?
Yes, my mission today is to find ice packs, cool packs. And so I'm hopefully placing a call to some of the chief executives that either produce or distribute. But we really need cool packs. We've got massive facilities and actually food longevity is critical. We're absolutely focused on highest levels of hygiene. The standards of the food preparation are exceptional. They exist as a huge purpose-made facility that normally supplies restaurants and supermarkets. I have 60% of the capacity there, courtesy of Nigel Harris, who owns that facility. And we got food products coming in from everywhere. And Dave Lewis at Tesco, amazing phone call. 8 o'clock on a Saturday evening, took my call. 20 minutes later, he came back and said, we're in. And we've got the whole of Tesco's behind us. And it will ultimately filter down to those people in the stores who I'm sure in one way or other will contribute. So a phenomenal resource. And I was extremely tearful at the point he said yes.
Charlotte, have you been able to have much input into identifying sites in particular need?
Yes, we've also worked in conjunction with the government identifying the sites that have been particularly badly hit. So the John Radcliffe is the first one. Just logistically, it's closest to our distribution centre, but this will be rolled out to Great Ormond Street as well, and then a whole list of other hospitals have been sent through as to which ones are most at need and which are hardest hit from the coronavirus.
And do you think this is something, Charlotte, that might stay in place post the current crisis? I mean, what's it like normally for a doctor when you work in these sort of immense 12-hour shifts and just sort of scoffing down a bowl of cornflakes or whatever at the end of the shift?
Yeah, I think it really depends where you're working. Some hospitals are brilliant and the food availability is great and it's fresh and it's healthy. A lot of doctors bring in their own food. What's particularly specific about this crisis is obviously the availability of food in the supermarkets at the end of a 12-hour shift and having that time to make something. Who knows if this will carry on? I think logistically it would be difficult to continue it for however long that may be, but it's definitely something to have in the back of the mind, food supply to hospitals in general.
Ron, realistically, how many NHS sites are you going to be able to service with this campaign?
Well, as you possibly realise, the National Health employs nearly 2 million people, and we have been really focused on the epicentre of the problem. These three categories of medics and nurses falling into anaesthetics, intensive care and A&E. These are the ones that have got the biggest segregation from the rest of the hospital. They are clinically in areas from which they can't move. So effectively delivering food to them and taking the stress out of their evening meal, plus knowing that their colleagues, when they are falling ill, are looked after. I think that's the core message. We're focused on the epicenter, but it is still thousands. And there are some other organizations who are, let's say, more focused on the other support staff at the hospital. And of course, there's many, many thousands. But I wanted a strategic, military, structured plan to deliver to this, as I said earlier, epicenter. And so we have to work with government because we want to be, I want the potency of this plan to work to the best effect. And they will target the ones which are really feeling the strain. And so I think with military operation, cooperation, knowledge and
Ron,
intelligence.
I have to cut you off there, I'm afraid. Thanks for joining me. And Charlotte, get well soon. Good to see you both. That's it from me. You've been watching Ian King Live. There's plenty more on the